Most of us know somebody who's been diagnosed with heart disease. You probably know someone who's lost their life to it. So it shouldn't be a surprise that it's the #1 cause of death in the U.S. But a new report shows that most Americans underestimate the dangers of the deadly disease. Yesterday, I had the opportunity to speak with a cardiologist from one of the leading clinics for treating and preventing heart disease. Take a look. It's the #1 killer of Americans. Heart disease takes the lives of more than 640,000 people in the U.S. every single year. A new 2020 survey shines light on just how underestimated heart disease is, especially when it comes to women's understanding of the deadly disease. Today, I'm joined by Dr. Paul Kremer from the Cleveland Clinic, the group behind the new study. And Dr. Kremer, first thing I have to say is I am a huge fan of the Cleveland Clinic because you saved my dad's life, but not only mine, but my executive producer's dad's life as well. So glad to have you with us today.
Good morning, Angie. It's good to be with you, and I'm glad to hear that we could help.
So February is American Heart Health Month, and according to the Cleveland Clinic's 2020 Heart Health Survey, a majority of Americans are misguided about how to take steps to prevent heart disease. Why do you think this is?
Yeah, I think as you mentioned in the introduction, a couple things strike me about the survey. The first is a lot of Americans don't appreciate that heart disease is still the #1 cause of death, affecting 1 in 4 people. And especially, most Americans don't appreciate that it's such a major cause of death in women. I think the second point to highlight in the survey is that a lot of Americans don't understand what steps they can take for prevention. And so why is that? Well, I think over the past few decades, we've made a lot of progress in decreasing mortality related to heart disease. However, we've seen that plateau in the past few years, but I think in some ways we've been victims of our own success, if you will. And as it relates to women, I think frankly, in the past we've focused mostly on men. And if you look at that decline in death related to heart disease, women have lagged behind. And so I think it's important to emphasize heart care.
Why is heart disease a leading cause of death in Americans, and do you see that this is improving over time with education?
Sure. So when I talk to my patients about heart disease, I really think of 4 pillars. The first is high blood pressure, the second is high cholesterol, the third is smoking, and the fourth is diet and exercise. And I think the progress we've made is because we tend to do a better job with high blood pressure, high cholesterol, and fortunately, people smoke less. However, we need to now focus more on diet and exercise, and that will be very important in preventing heart disease.
How important is it that doctors and patients discuss nutrition and weight when it comes to heart health?
I think it's incredibly important. And the main reason is that it's often very difficult for patients to make improvements in diet and exercise. And it can be daunting if you don't eat well or if you have a sedentary lifestyle to make dramatic changes. But if you meet with your doctor regularly, you can focus on small steps to try and improve your health.
Dr. Kremer, for anybody who's watching today, what is that first step to develop a heart-healthy plan?
Sure. I think that's a great question. So as it relates to diet and exercise, for exercise, we recommend 150 minutes per week of moderate exercise. So that's 30 minutes most days of the week. Now, if you're doing nothing, it's very hard to go from that to 150 minutes per week. So I think the important point to emphasize is every little bit helps. So start small and improve gradually. And that's why I think it's important to emphasize this education at every visit. In terms of diet, another thing to highlight from the survey is that most Americans didn't recognize the diet that's healthiest for your heart. And we tend to recommend a Mediterranean-based diet or a more plant-based diet, and simply put, that means less meat and more vegetables.
Well, thank you so much, Dr. Kremer, for taking the time. To learn more about the Cleveland Clinic and their research, go to clevelandclinic.org.